Welcome to Entrepreneurs in Healthcare. I've come to realize that entrepreneurship discussions are long overdue in medicine. I'm pairing up with voices from healthcare that value entrepreneurship and that are willing to come on the screen with me and hold a discussion. I'm hoping that hosting these conversations will open up pathways to making progress in medicine and not making entrepreneurship a bad word. Join along on this series as we dissect entrepreneurship, healthcare, and everything in between. Hi, everyone, and welcome to another episode of Entrepreneurs in Healthcare. And this episode, sitting across from me virtually, is Dr. Rachel Beanland. So, Dr. Beanland, before we begin with the question of the hour, please introduce yourself to the audience.
Yeah, thank you. Thank you for inviting me to be here. I'm really looking forward to this conversation today. So I am a UK trained doctor. I live and work in France. I started out my career in clinical medicine and I transitioned into public health. So in the UK, you can specialize in public health. So I continued my passion for public health and making an impact at that level. And it's taken me on to creating my own business, doing consulting. So all of my consulting work is really focused on infectious diseases, HIV, TB. That's my big passion, working with NGOs and UN organizations. And I'm really, really interested in that transition for people, that transition from clinical medicine into non-clinical medicine, following the pathway I had. So alongside my consulting business, I'm also a physician coach, and I support other women in medicine who are looking to create a more flexible career, make a bigger impact, think about trying to find their priorities in their life and balance their career with everything else they want to do in the world.
Well,
That's a summary. That's a summary.
And I'm already thinking of some questions to ask you specifically about that public health as a specialty mention. But before we do that, I need to ask you the question of the hour, and that's entrepreneurs in healthcare, good or bad?
I think for me, what I really think is the joy of medicine is diversity. I think that we can all practice medicine in ways that feel authentic to us. And so therefore, I wouldn't rule out the entrepreneurship as part of that world, as part of medicine. I think there is a role that it can play. So for me, it's a yes, definitely.
Okay. Now, what specifically is the role that you believe the entrepreneurship can actually play in healthcare?
Well, I suppose it does two different things. One for me is for the doctor themselves, the person who is following their career. And I think what being an entrepreneur can allow you to do is it can allow you to follow different passions. It can allow you to think outside the box, often practice in a more holistic way, potentially outside sometimes a rigid system. It can allow you to explore lots of different skills, in the world that we live in now. A lot of that can be online skills, it can be communication, interacting with partners. It can really allow you to follow what feels more authentic to you, I believe, if that's the path that feels right for you. But on the other side of it, I think there is also a potential to increase the impact that we can have as doctors and increase the impact that we can have both nationally, regionally, and globally by being able to offer our skills in a different way. Obviously, I strongly believe that everyone should have access to be able to be the healthiest that they can be. And so it's allowing innovation, it's allowing creativity in that system to support people. So I think it does have a benefit for both the patient, the client, and the individual as a doctor.
I particularly like that you use the word innovation here. I just published an article that I actually wrote on SoMeDocs in our magazine, and it kind of was piggybacking off of Dr. Michael Hirsch's episode in Entrepreneurs and Healthcare, and his mention of sort of, what doctors are sort of supposed to do and when doctors are good versus when they're bad, and kind of, expanding on that concept of doctors being, quote, bad. And when I say bad, I don't mean like practicing unethically. I mean bad as in practicing outside of the lines that medicine sort of colors for us and isn't necessarily used to. So, like, the word innovation for me, right? A lot of innovative things are just things that we just aren't used to, or maybe we just don't know about. But that doesn't mean that they're wrong. So, like, even things like a doctor podcasting, right, was never really traditionally a thing that doctors did, right? We just used to either practice behind closed doors, or we, in the really older times, we made home calls with our little doctor bag. And in the really old times, I mean, barbers were acting as the doctors. So again, I think innovation is just about sort of embracing the new and bringing on the things that the rest of the world is doing and kind of trying to apply it into medicine to sort of better, obviously, to better the health of patients everywhere. What do you think of that? Like, in terms of the whole good and bad and sort of staying within the lines of what we're supposed to do?
Yeah, so that's really interesting because I had a conversation with someone this week in a similar line to that, in the sense of what do we believe a doctor is? And actually, so where I went to university, we had an oath which was specific to the school that I went to. So, we all sign these oaths. We all practice alongside our medical councils in whatever country we're practicing. And when you look at that, what we are signing up to do is to be the best version of a doctor that we can be. It's to ensure we do no harm. It's to ensure that we are practicing ethically, that we are being equitable, that we're providing that service. It doesn't dictate what that looks like. And that's where I really think that sense of innovation, that sense of potentially creativity, being allowed to step outside those constraints. And there is a place for those constraints, within a system, within a lot of healthcare systems, those constraints and those the rigidity is there, I guess, to keep people safe. It's there to do that, to provide a service to a certain standard, to ensure that we're doing that. But I think there is so much space for that creativity and that innovation. And I think without us stepping into that, we potentially, like you said, we potentially can be left behind as a sector. We can potentially be left behind as a body of very highly skilled, intelligent people who have a lot to offer the world. And I think if you look in, even since I have graduated, 25 years ago, so much has changed in terms of what we're now able to share with people around lifestyle medicine, around nutrition, around, the microbiome. And I just don't think these things necessarily happen if we don't start to step outside of those norms, start to think differently. The communication aspect of it, which is what you do so fantastically, is actually so important to reach people on a broader scale, because this is what people are using to get their information. It's where people are seeking information.
Absolutely. And going back to my own history, I mean, that's what I noticed when I stepped away from medicine. I mean, many people that are listening might know my backstory, but I've lectured on it and things like that because I had such an impact in my own life by doing that I decided to sort of share it with others. And that's stepping away from medicine so that it's not your everything, and suddenly having like the whole world open in front of me and realizing, among other things, that the online world makes so much impact to people outside of medicine, and that the medical world was surprisingly missing from the place that was making impact. And so, things like pseudoscience was happening, and things like people that are lauded for their stances on medical issues and aren't really in the medical field was happening too. I mean, even down to like our superstars and our celebrities, right? The celebrities that star in movies making decisions about whether or not we whether it's take a medication or whether we vaccinate, but really it's people that have zero to do with science influencing the rest of the world.
Yeah. Yeah, that's so true. And I think there's such a place for us to demonstrate that science, that robustness of how evidence is formed. But also, I think as doctors, as physicians, we also have a role to play in interpreting that for people, which is, what we have been trained to do in that sort of patient doctor relationship. But when you have a limited amount of time in a consultation, it can be challenging to really explain these things to the right depth. And I think it's finding new ways to reach people. It's finding ways that people can understand, they can grasp information. And in the world that we live in, where digital, that we are in a digital age. You and I are in totally different countries having this conversation and connecting with each other. And I think that we have such an opportunity to use that space to share information with people and to educate, to support people. And like you say, be the voice that fills that void, so that the voice is not filled by misjudged evidence or false evidence.
What a great segue, because I was actually planning on asking you out loud. I know because we talked right before the recording, but I thought it was fascinating where you're located. And then you mentioned that we're in different countries. So tell us, where are you?
So I live in France. I've lived in France for 10 years. It was a big part of what I wanted to do, to be in an environment that allows me to thrive. So I moved both for my career, but also for my personal life. I really enjoy being in the mountains. I love being surrounded by nature. It's very important that I can find that space for me. But I also moved so that I could be able to explore my career in global health. I was really keen on working with UN organizations. So it gave me that opportunity as well. And now I have an organic farm, which I live on. So I'm very connected to what I'm eating. We're growing all our own food. It's another part of my, life and dream that I've been able to combine with everything else I do. So for me, it's the place that I feel the most at home, and feel that I can be the best version of myself and be the best doctor that I can also be.
Can you tell everyone specifically where in France you are?
Yeah, so I live in the Pyrenees, which is a mountain range that stretches all the way between Spain and France. So we're just on the French side. So yeah, if I look out my window ahead of me, it's just mountains. That's all I can see.
Amazing. Are they the type of mountains that can be skied on?
Yeah. There's a lot of skiing. There's a lot of hiking. But this part we're in is a very wild part of the Pyrenees. So it's not that populated. The biodiversity is incredible. And that's really, also a big attraction for me, to have that sort of connection.
Amazing. And do they groom the trails there? And do you ski? That was my next question.
Yeah. So there are a few ski stations around, but there's also a lot of ski touring, which is, when you're sort of doing the skiing, you're going up on your own and then you're free riding. So there's a lot of that around in the mountains here. When we get enough snow, which obviously just depends on the seasons. And as we've noticed in the last couple of years, the climate has really shifted. It's quite noticeable here that the climate has changed quite significantly.
Wow. And I assume, and we spoke earlier too, but you speak French.
Yeah. So I have always loved languages, which is interesting because it goes back to that sense of creativity. It was something that I was very fortunate. I had amazing teachers when I was younger. So I actually learned Spanish as my first language, and then learned French. I worked in Spanish for some time in Honduras as part of my clinical work. And the French I had completely lost. But when we arrived here, it was really important for us to be able to learn French, to be able to connect with people, to live here. So it's an ongoing process. It's definitely much more challenging to do it at a later age in your life. I would encourage anyone who wants to get, their children to start learning languages, please do that, because, I really wish that I had pursued more languages and continued when I was younger.
Wow, really interesting. That's great advice for parents out there. I'm a parent, so that's really hitting home. There's so much that children can learn these days. Sometimes it can get overwhelming, between instruments and language and math and science and so many things. But, our brains are so elastic and so almost like flexible, for lack of a better word, at younger ages. Um, so back to entrepreneurship, since that's the focus of this episode. I'm going to ask you, well, did we talk about you being a coach? I think you mentioned you're being a coach, correct?
Yeah, yeah.
I'm going to ask you a few difficult questions that I actually asked Dr. Karen Bernard on a recent episode that we did with her that's going to be published soon. We'll be right back. Hey everyone, Donna Coriel from SoMeDocs. SoMeDocs has just newly released its Side Ventures series. It joins a stellar lineup of other fabulous video and podcast series, including Entrepreneurship in Healthcare, SoMeDocs Conversations, and more. In fact, we're working with our members to create more interesting and unique shows to share with you. But if you're interested in side ventures, we do also have a Facebook group that's been built just for doctors that are curious on what else. Check out the Facebook groups that we manage at doctorsonsocialmedia.com/our-Facebook-groups. I'll see you there. Back to our show.
Yeah.
I'm going to ask you a few difficult questions that I actually asked Dr. Karen Bernard on a recent episode that we did with her that's going to be published soon. We did publish it. Here's a snippet of that episode.
Yeah, and I first want to say that that's if that's the perception that, and I've heard that before, that is, that's a real shame if that is happening. I've thought about this a lot, in my own business around, am I working on the wrong end? Should I be getting into organizations and working with leaders and trying to change the system to make it better?
Back to the episode with Dr. Beanland. And it's about the field of coaching. And I just think it's only fair that I ask it to more than just Dr. Bernard so that more people have the ability to actually answer. So the first question was that regarding the field of coaching, there's a lot of mumbling in the physician communities behind the scenes about people that question whether coaching can sometimes take advantage of the vulnerability of physicians during a time when burnout is at such an all-time high. Can you speak to that?
Yeah, so I think there is a concern there. And I think it does come from, as you say, a very high level of burnout and a very high level of stress and anxiety and health problems within the physician community. So it is a real issue, I think, in terms of how coaching can support that or how coaching can play into that. I think there is such a powerful role for coaching that I don't think, if you can find those coaches that are practicing in an ethical way, that you're feeding into anybody's vulnerability. So yes, it can be there as an amazing tool to support people through burnout. And there are specific coaches who really support with burnout. Yes, it can be an amazing tool to give someone that space. Ideally, I believe it would be amazing if everyone had a coach. If all of us had a coach from the beginning of our med school all the way through our careers, it would be incredible. It would be absolutely incredible. But we are not living in that type of world yet. So I don't think that it feeds on vulnerability. I do think, however, there is a place for us to be very aware and conscious of how we interact with people, particularly in the online space. And I think this is where maybe some of the concern can come from, is that the online space itself, I feel, can be a very difficult place to navigate if you are not in a great place for yourself. It can often be very triggering. It can be very emotive. And I think that's where we all, as individuals, have a responsibility to think about what we're posting, to think about what our messages are, to think about how we're interacting with people so that we are as genuine and authentic as we can be, and that we can offer the support that people need. And also to think about that, goes back to that sense of practicing as a doctor, of realizing that you might not be able to help someone. Can you send them somewhere else? Can you signpost them to someone who can help them? Can you identify when someone's in a crisis point? I don't think there's any problem with having a wealth of physician coaches, because I think that physicians who are coaching have incredible skills to offer. So I don't think that that is an issue itself. There obviously is a bigger issue at play around burnout and how systems can also support people in burnout. So I'm not sure I've totally answered the question, but hopefully I've given a sense of, I think we all have a responsibility to be conscious of it.
Yeah, absolutely. And we should always be conscious of everything that we do in this world and sort of have our eyes look out basically for, any potential scams. I mean, this is clearly not referring to scams, but back to what you were saying about the real need to find the ethical coaches. My question is, well, how do you have any tips on how the physician community can choose a physician that is ethical, for example?
Yeah, so I think that's a really good question, because there is a lot of discussion generally in the coaching community about, how can you ensure that people are meeting similar standards? How can you ensure people are meeting similar ethics? At the same time, I do think that there is a role to be played for allowing people to be themselves and to have their own backgrounds, where their training has come in, where their roles come in. And actually, just because someone has done a training as a coach doesn't mean that they're going to be a really good, fantastic coach. It's a certificate and it's a training. So it should also be taken into account with everything else that that person is sharing. As a community, what can we do? I think what we can do is to try and find places that people can look to. And I know this does happen globally, where people often group together. Coaches, have certain platforms where people can find more information about coaches. I think that as an individual, the biggest thing, and I often say this to my clients, is the biggest thing is the connection with someone. If you feel that that connection is there and that person is going to help you at that moment in time, then you're probably going to get a lot out of that experience. And if that person is in burnout and that coach is going to help them in burnout, then I don't think that is, I think that is ethical. I don't think that's an unethical issue. If someone is seeking help and finding it, then I think, then that for me is a balanced approach. So I think I don't think necessarily that regulating physician coaches is the whole answer. But I think we can create spaces where people are able to collaborate, people are able to share their differences, their similarities, and allow people that choice.
I love that. Redefining norms, once again, is coming up. I love that because I try really hard, just as myself as a human, to be non-judgmental when I come across like new entrepreneurial ventures that doctors are taking and trying out. So, for that reason, I built the coaching directory in SoMeDocs to just kind of say, hey, these are verified physicians, these are verified doctors, and then they're doing coaching.
We'll be right back. Did you know that SoMeDocs has its own coaches directory? Find it under the directories tab. We have directories for podcasts, books and blogs, YouTube channels, speakers, courses, communities, and of course, coaches. Inside the coaches directory, click into any coach that's relevant for your needs to learn more about them. You can even use filters to narrow down your search. Find it all at doctorsonsocialmedia.com. back to the show.
There's no ranking system, and one person could be great for person A and another coach could be great for person B. Dr. Hirsch, for example, was talking about, being a male coach. There's not a lot of male coaches. And so a lot of men sometimes look for a man coach, and they think that it's just an easier way to bond with someone. And similarly, a woman might be seeking a female coach to help her along the way. And so again, I think there's all kinds of different attributes that a person can bring to the table. And like you said in the beginning, it's the diversity that really makes the field interesting and hopefully can help the doctors in it. Here's a question that a lot of our audience is always interested in where it comes to coaching. And I know we're going to also cover some of that in the non-clinical conference that, by the way, Dr. Beanland is going to take part in. Can you quickly actually tell us about what you're going to be speaking about at the conference?
Yeah, definitely. So super excited to be part of the conference, which is in November. So I'm really going to share how to create a positive mindset as you transition. A lot of my own transition was really helped by me diving deeper internally and building up skills in terms of mindfulness, in terms of positive psychology, that positive mindset. So I'm going to share some skills, some really practical things that people can think about to really enable them to adapt through that transition as they start exploring different careers or they step outside of clinical medicine altogether and really think about their own health and well-being as they're doing it.
The question that I had in mind to ask is, what are the prices that coaches charge nowadays for a session with a physician?
Yeah, so I think that also varies enormously. So there's a couple of things I would love to say about that. One is if you are a new coach, I would say do not look at other people's prices. And I often say this to my clients who are developing their own businesses as well, is start off with what feels comfortable for you. It's a transaction. It has to feel energetically right for you. So start off in that place, and that will always be easier for you to be able to create your business, to be able to create your clients, to have your space in. So as much as possible, try not to compare too much. In terms of what people charge, it does vary a lot. Obviously, it varies in terms of what people feel comfortable charging, how much experience they have. I think you could probably have a range, probably anywhere from $150 to probably $450 for a session. I don't tend to do one-off sessions at all because I really feel that people need that ongoing space. And that's where I find for my clients, they get a much better experience if we create that space where they feel really safe, they feel really respected, and then they get that continuous accountability. So for me, I usually share people programs that take people through a journey, take people through a certain challenge that they're going through or a certain transition that they're going through. And so the pricing is going to vary depending on what the package looks like. And I think that's probably the same for many other coaches out there too.
Okay, great. Yeah, I know nothing about it. I don't know how much people charge, but I do know that there's interest and there's questions about that, et cetera. We also spoke about, and this is an interesting question, you raised the term certification, and it was brought up in that Dr. Bernard episode as well as to whether certifications are necessary or not. As well as the cost of these certifications. Anything to add in that perspective?
Yeah, so I do think that's a really interesting question because myself, I've had coaches that have not been trained coaches and they have been incredible. So I didn't care whether they were trained or not as a coach. I just wanted them to coach me because I believed in what they were sharing. I loved their approach and we connected. And so these are coaches for business coaching to be able to support, building my businesses up. So it's interesting that I do not feel that it needs to be a given. If it's something that's very important to you, then obviously you can use it as a filter to identify a coach that you really, want to make sure that you're certified. So I have trained to be a coach myself. I think that was important to me to add to the skills that I have, to be able to pick and add in different things that I know that might help my clients. So I think it's helped me to be a better coach. But likewise, some of the other things that I'm trained in, so I'm a yoga teacher and a meditation teacher, those are also incredibly valuable to my coaching, and they impact on my coaching style. And I think every coach, a lot of physician coaches probably pull in from all their other expertise. What we've done clinically is obviously going to be interesting and important to how we approach situations, our own experiences often. And I think that can be the really powerful part of coaching, is our own experiences. You're usually coaching people who are somewhere where you may have been, and they can see where they'd like to get to with you.
Fantastic. Well, that was really great in terms of an episode and answering those questions that I think are difficult to answer. So I do thank you for that. Looking very much forward to hearing you speak at the non-clinical conference. We have quite the lineup already in place. So that's going to be really wonderful. And as we close this episode, is there a particular ask that you'd like to leave our audience with?
Oh, that's a great question. An ask. I would love to focus on the element that we discussed around being conscious, and being conscious about how we show up for ourselves, and being conscious about how we interact with other people, whether you're a coach, whether you're a physician, whether you're both. Maybe you've even left medicine and you're interacting with people. I think for me, it's just really moving into that level of being conscious about our thoughts and our words and our actions.
Fantastic. Thank you for those wise words. All right. Well, thank you for being with us. And if you're listening to this or watching this and you loved the episode, please don't hesitate to share it. You can, of course, tag SoMeDocs, and we will come in and thank you. And tune in for our next episode that's coming in. Thanks so much.
Thanks so much for listening.